Welcome to Advancing Health. Traditionally, healthcare providers have been very hesitant to seek help for the burnout and mental health challenges that many of them face. That is changing for the better, as we hear in this podcast about efforts to destigmatize seeking mental health services for care providers, about being okay with not being okay.
Welcome to Advancing Health. I'm Rebecca Chicky, the Senior Director of Behavioral Health at the American Hospital Association. And it is my honor today to be joined by Corey Feist, the CEO and co founder of the Dr. Lorna Breen Heroes Foundation, and Tiffany Lyttle, RN and Director of Cultural Integration for Centra Health. Today, we are going to talk about the ways that hospitals, health systems, and even states and regions can get involved to reduce the stigma and improve access to mental health care services for all our healthcare workers. Corey, I'm going to direct my first series of questions to you. Quite honestly, tell our listeners, what is the mission and vision of the Dr. Lorna Breen Foundation, and why was it founded?
Thanks for having us today, Rebecca. We're so grateful for the support of the American Hospital Association in our work. The Lorna Breen Foundation was created in the summer of 2020 following the death of my sister in law, Dr. Lorna Breen, who was an emergency medicine physician in New York City and a leader at New York Presbyterian Hospital. Our mission is to support the well being and job satisfaction of all health workers in the United States. We envision a world where seeking mental health care is viewed as a sign of strength for our healthcare workers.
That's an incredibly powerful mission and a beautiful vision of the future. I know that the Dr. Lorna Breen Foundation is not doing this alone. In fact, I believe there is an organization, and AHA is part of it, called All In, Caring for Caregivers. Can you describe the relationship between the Dr. Lorna Breen Foundation and All In?
Absolutely. And as you noted, the AHA has been a really important partner of ours. With my background as a healthcare leader, I noticed that there are a few silos at healthcare. And so one of our primary goals at the Lorna Breen Foundation was to bring together healthcare organizations in an interdisciplinary way to wrap our arms around the mental health and well-being of our workforce. So in the spring of 2021, we created a coalition called All In Wellbeing First for Healthcare, whose focus was really to break down those barriers to mental health access and to accelerate solutions to this growing burnout and mental health challenge that the healthcare workforce had. As part of the work of the All In Coalition, we created All In Caring for Caregivers, which is a technical assistance program which has three main phases. First, to remove barriers to mental health access. The second is to educate healthcare leaders on what they can do in their sphere of influence and control about addressing well being from a systems perspective as well as an individual perspective. And then it culminates in a year long learning collaborative. We do this work focused on getting at the root cause of many of these issues. We do it in an interdisciplinary way, and we try to bring together states or large metro areas of hospital systems and their teams to do this work in a very transparent way so that their workforce can see the work is being done and so they can learn from each other about evolving best practices. And that's how we met Tiffany.
That's wonderful. Tiffany, I can't wait to get to you for a couple, but I have a couple more questions for Corey first. Corey, some of the listeners may not understand when you say removing the barriers to access for mental health care. They may think they're working in hospitals and health systems. So of course, they have access to mental health care. Can you go a little deeper on that and describe some of those barriers that you're trying to remove and mitigate?
And it's a great point, Rebecca, because when my sister-in-law took her life in April of 2020, I had been in healthcare for many dozens of years, actually many decades, I should say. And I was a leader at the University of Virginia Health System, yet I wasn't a clinician. And so I was completely unaware of the stigma as well as the professional barriers and really potentially penalties that healthcare professionals in the United States have. These mostly appear in the form of overly invasive and really inappropriate questions that clinicians are asked about whether they've ever been diagnosed or treated for mental illness. whether they've gone to therapy. And these are the same questions that my sister-in-law was terrified that she would have to respond to following a singular mental health episode. And so what we have been able to do at the Lorna Breen Foundation through our All In Coalition and Caring for Caregivers is to get tools to the front lines, whether it's a licensing board that's asking these questions or hospitals who ask these questions most commonly in credentialing applications, and have them change those questions and then importantly communicate the changes to the workforce. As I sit here with you today, there are 1.5 million health workers in the United States that are benefiting from the changes that we've made, which we hold out in the All In Wellbeing First for Healthcare Champions Challenge for licensing and credentialing badge that we give out to hospitals as well as the licensing boards for doing that important work.
Thank you. I mean, I don't think many of the listeners may have realized that those questions were, have you ever, as you noted, have you ever been treated?
And if I could just add one thing, because the American Hospital Association a couple years ago published their first ever suicide prevention guide, at least the first ever that I'm aware of. And in that suicide prevention guide, you identified three key drivers of suicide among health workers. And the first one that you all identified is this concern around the loss of license and credentials associated with the stigma for mental health care. So we know that for Lorna, this wasn't just an isolated incident. And it's something that we hear from health workers all over the United States that they are fearful for these repercussions. And so we need to do something about it and address it, which is what we've done across the country. And we've made great strides.
Thanks for mentioning that. There's a variety of drivers for this concern and this stigma. So thank you. I want to turn now towards another thing that you mentioned earlier, Corey, and that is working with states, working with large health systems in order to advance this in their own organizations and across a particular geography or a regional area. And I'm going to call out specifically the Caring for Virginia caregivers work. Can you describe that a little bit? And then we'll bring Tiffany into the conversation.
Absolutely. 2 seconds of background. When the President of the United States signed into law the Dr. Lorna Breen Healthcare Provider Protection Act, it created two spheres of programs. And one of those sphere of programs was learning materials for healthcare leaders to address the root cause of burnout as well as mental health challenges. That was called the Impact Wellbeing Guide, which was led by the CDC, and our All In Coalition provided guidance on it. What we heard from the large health system across the country that was implementing the guide is they like to do this work together at a learning collaborative and they need some help. And so, caring for Virginia's caregivers, caring for North Carolina's caregivers, caring for New Jersey's caregivers, and now caring for Wisconsin's caregivers are all efforts for us to take organizations through the phases of work from the Impact Wellbeing Guide. And that begins by addressing these mental health barriers. It then moves towards education of 10-person teams across health systems to address the issues at the root cause and become educated about the solutions. And then finally culminates in a learning collaborative focused on an operational initiative that drives burnout. And that's what we've done with Tiffany and the team in Virginia, now North Carolina, New Jersey, and recently expanded into Wisconsin.
That's fantastic. Tiffany, I bet the question on many listeners' minds is why did Centra decide to join the work of All In, of Caring for Virginia caregivers?
At the time, we had some really innovative leaders that understood that well being wasn't just a nicety, but rather a necessity for us to drive healthcare forward, not only to our communities, but also to our healthcare workers. So, 2019, we really started pulling together the evidence base for this work. And what we saw is that healthcare workers were far more likely to suffer from depression, to have thoughts of suicidal ideation, to have biopsychosocial disturbances, and of course, use substances to help them cope with their roles. But we had never provided healthcare workers with the avenues, tools, and support that they needed to be able to speak up and say, hey, we need help for coping with, the very large burden of taking care of our communities and healthcare in the United States. Those were all published before 2019. So, of course, you know what happened after 2019. We went into a global pandemic. So, we really need to find avenues that we could help support our healthcare team members, not only address their own well being so that they can carry that forward, but also not place calluses where we should have compassion because we were facing a compassion crisis, right? And when we tell people, you have to be strong, you have to be confident. And yes, we are all of those things, but we also have to deal with very messy, beautiful situations of life and humanity. And that can take a toll on us. It can leave echoes and it can leave scars, but we are well practiced in taking care of code situations. I mean, if you think about a code situation, we are practiced, rehearsed, we simulate it, we educate to it, we certify to it every single year. We have avenues and tools to help us be better at coding situations and situations of that nature. What do we have in place for taking care of ourselves? Nothing. We don't teach that in school. We don't simulate that. We don't go over it. We don't get certified to it. I mean, now we are starting to see some certifications for healthcare organizations come through. But that was about the time that we found the Lorna Breen Foundation. And what perfect timing, that we really needed to find a place for getting those tools for helping support us in that work and removing the stigma. And I have to say that's been one of the most important parts of engaging in our healthcare workforce's well-being is destigmatizing healthcare, destigmatizing being okay with being not okay. It's okay for us not to come out of a situation at work and feel not okay about it. We have to be able to have those avenues. And when we stigmatize it and put licensing questions like, have you ever seen anyone for mental health resources, or in the nursing realm, which is where I live, where our CNOs actually have to report this to the Board of Nursing. When we have those stigmatizing questions, we are putting that barrier in place and saying, it's not okay for you to get help, because then we're going to question your entire life, your livelihood, and how you perform.
Can you give the listeners a little bit more about you described the journey well, but who led this journey? Was it your C-suite leadership? Where did that backing come from?
We have wonderful champions here in our C-suite. At the time that I was actually hired into this role, my original role was patient education and nurse wellness. So it was really leading the work with nurses and how we were engaging. We published research. Our CNIO was actually one that led this effort to make sure that our nurses were healthy and well because the national data is that we are hemorrhaging new nurses at a rate of 1 in 3 in their first year. We'll leave the profession altogether. So, what can we do to support that work of us being healthy and well and really figure out what those drivers are? So, as we engaged in this journey, we started seeing really positive things like retention, engagement, and better quality of work, and better patient experience scores and better engagement scores. And we saw our nurses that were travelers even wanting to stay in Virginia, in rural Virginia at that, not going to these major cities because they said, this is the first place I've been where I feel healthy, where I feel like I can actually get the help that I need.
So I will tie that back to your title, Director of Cultural Integration. It sounds like the impacts that you've been seeing, as you just described, are really that you have created a culture that not only better supports the mental well-being of the nursing and other clinical staff, and I'm assuming administrative staff as well, but at the same time, you are, having a positive and let's talk about the positive financial return on investment because what it takes to recruit a new nurse and train them or any new clinician or healthcare worker, is a significant cost, and it's a lost opportunity cost of retaining those who often leave. So it's having multitudes of impact, if I hear you correctly.
Yes, absolutely. Not only with engagement, but also our patient experience. If you think about it on Maslow's hierarchy of needs, if you are struggling with just physical safety, you're not going to find enrichment. That's not going to be part of your day. Your day is going to be, I need food, shelter, and water, and need to not be hit. So actually, we contributed to the suicide prevention workbook. We actually have the piece on how do we respond to workplace violence, because that is one of our drivers for burnout in healthcare communities. But even in addition to that, SHRM put out a study. It's part of their civility work and their scorecards. Incivility in the workplace is costing $2 billion a day in the United States. $2 billion a day. We can't possibly engage with innovations, creativity, open communication, safety, even. This all ties back to wellness. So when I started off by saying that it's a necessity It's not a nicety. A lot of people hear well-being and they're like, oh, that's nice. It's really nice that our nurses get, or our physicians, they get an opportunity to talk about what's going on in their lives. But it's so much more foundational than that. If you aren't healthy and well, you aren't engaging in all those things that we need to engage in, because we are stronger together if we're working towards things like recreating healthcare and making it accessible to everyone. So it's not just how it plays out for our community members and how they are treated, it's also how we treat each other and how we are healthy enough to even engage in that work.
So many positive impacts of this work. Thanks to both of you for being willing to share your time and expertise with me, with the listeners for this podcast. And I encourage everyone to go to the Dr. Lorna Breen Foundation website and get involved, get engaged, and change the culture of your organization and remove those barriers and stigma for the healthcare workforce who may need mental health treatment.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.